Okay, today I'm going to be talking about stress and health psychology. These are actually relatively new areas of psychology, at least health psychology is. The role of stress in influencing our mental functioning and our behavior has been studied for quite some time, although the acceptance of the role of stress and psychological factors in our physical health is a relatively new area of study, and the growing field of health psychology sort of demonstrates the growing role that psychology is playing in health-related disciplines. So first of all, we need to start out by defining what stress is exactly. Stress is really a non-specific response of the body to any demand made upon it. The arousal, both physical and mental, to situations or events that we perceive as threatening or challenging. You can kind of think of it as the equivalent of when you exercise and you pick up weights, you are stressing your body, or when you go running, you're stressing your body. You're placing demands on it, usually for the purposes of trying to make it grow, and that's one of the things that we see in the context of stress is that stress can be a source of growth for us, depending on the nature of the stress that's being experienced, that is. So we're going to use the term stressor to refer to sort of a trigger or a stimulus that prompts a stressful reaction. There are actually two different types of stress. Eustress, which is the pleasant and desirable stress. That is, sometimes events are pleasant, and yet they're considered to be stressors in the sense that they place demands upon us. But when we usually think of stress, we think of distress. That is the unpleasant and threatening type of stress, the type that most of us would like to avoid, at least when we're experiencing levels that exceed our ability to cope with those stressors. And based on the research that's been done on stress, there are different sources of stress that have received a lot of research investigation. Okay, there are life changes, there are chronic stressors, job stressors that I'm sure most people are familiar with, daily hassles that are less severe types of stressors, but tend to be more frequent in their nature. Frustration, also conflict, and of course cataclysmic events. The major events that take place that include traumatic events, that is. So when we talk about life changes as being a source of stress, there are some researchers that believe that just adjusting to major life changes causes some degree of stress. And in fact, there have been rating scales that have been devised in order to attempt to measure the magnitude of the stress. And this is some of the earliest research that was done on the relationship between stress and physical functioning. And so just to give you an idea of what kinds of stressors or life changes you'll see on this rating scale, here's a copy of it. Okay, so these numerical values here represent sort of differing degrees of stress that are experienced based upon these different life events. So for instance, death of a spouse is presumed to be the most the highest or strongest stressor that one could experience, whereas something like a minor violation of the law is on the opposite side. It's one of the smallest or weakest stressors that could be experienced. And so this is an interesting scale in the sense that you can sort of tally up what events you've experienced in the course of the past year, and you can get a number. So in fact, I encourage you to do this. If you add up these life change units, as they're called, over the past year, then generally a score that ranges from 0 to 49 is usually taken to mean that there are no significant problems, whereas scores that range from 150 to 199 are seen to be associated with a relatively substantial increase in the chance of illness. A score of 200 to 299, on the other hand, is indicative of a moderate life crisis, whereas a score of 300 and above is seen as being indicative of major life crises. And just in terms of those numbers there, it's important to make note that you actually have to multiply these you can just add up the number that you've experienced. That's a different scale that I was thinking of, where you have to multiply them. So that just, it kind of gives you an idea of, very grossly the amount of distress that you've experienced, or stress you've experienced. As I said, not all of these are necessarily distress. Some of them are actually eustress. For instance, going on vacation can be a source of eustress. But it sort of is a fun way to give you an idea of the amount of stress that you've experienced. Although you have to be a little bit careful in terms of how you interpret those values, because they don't correspond to any specific measure of stress per se. They're sort of arbitrary values that are just meant to, again, give you a sense of how much stress you've experienced. So cataclysmic events, another source of stress. These are stressful occurrences that occur suddenly and generally, and usually affect many people simultaneously. For instance, natural disasters or terror attacks, things like this. Chronic stressors, these are more longer term, persistent situations or events that have the potential to wear you down and make it difficult for you to relax, again, because of the chronic long-term nature of the stressors. So, many times students can relate to the idea of chronic stressors as, sometimes a semester can sort of wear you down over the course of time with quizzes, exams, papers, and also while going to school and working. So those can be chronic stressors. Job stressors are another major source of stress. These are work-related stress, and they include things like unemployment, difficulty keeping a job, changing jobs, not having good job performance evaluations. So jobs really do vary quite a bit in terms of how stressful they can be. But the most stressful types of jobs tend to be those that make great demands on performance and concentration, involve a little creativity. In other words, you are sort of told exactly what to do, and you don't really deviate very much from that. And also those jobs that have a little opportunity for advancement are seen as being more stressful. And of course, just because we're talking about job stressors, it doesn't mean that it doesn't have a toll outside of the work environment as well. Now, another source of stress is conflict, and there are different types of conflict that we can experience. There's something called approach conflict. This is when we're forced to make a choice between two options, both of which are equally desirable, and generally this is a relatively easy conflict to try to resolve, and it's the least stressful out of the three that I'll be mentioning. For example, when you have two equally desirable job offers, but you have to choose one of them because you need to take a job, not a terribly difficult conflict to resolve, and not particularly stressful in comparison to these other two. The avoidance conflict, on the other hand, is when you have to make a choice between two options that are equally undesirable. So, for example, choosing between two jobs, neither of which you necessarily would like to take, but you need to take one. Now, these can be difficult and quite stressful, and they are generally resolved with a long delay and considerable denial at times. The approach avoidance conflict type is when you're forced to make a choice with one option which has equally desirable and undesirable characteristics. So, for instance, taking a high salary job, which is the approach component, but it's in a location that is undesirable. That's the avoidance component. And these can also be difficult and be stressful types of conflict. They're also generally resolved with a delay, and sometimes with a partial approach component to them. Again, another fun way to sort of think about how much stress you're experiencing as opposed to the other scale that we just looked at a few minutes ago. This one looks at the number of daily hassles that you experience. So hassles, these are small problems of daily living that, again, they accumulate over time and sometimes can become a major source of stress. And so, even though the cataclysmic type of events can be, sudden events that are experienced as very stressful, the smaller ones have the potential to accumulate to have the same net effect as the cataclysmic events. So take a few minutes and think about what are some of the top 10 daily hassles that you experience. Again, these are small problems of daily living that tend to accumulate, and when they're persistent enough, they can lead to a state called burnout. Now, most people have probably heard of the term, or maybe even used the term burnout before. It has been used in the general public. But it actually does have some research backing behind the idea that people can experience a burnout, particularly when it comes to their jobs. In fact, there have actually been 3 key dimensions of this burnout response that have been characterized by research. They include an overwhelming exhaustion as number 1. Number 2, feelings of cynicism and detachment from the job. And number 3, a sense of ineffectiveness and lack of accomplishment. So the exhaustion component actually represents the basic individual stress dimension of burnout. It refers to feelings of being overextended and depleted of one's emotional and physical resources. The cynicism component represents the interpersonal context dimension of burnout. It refers to a negative, callous, or excessively detached response to various aspects of the job. The component of reduced efficacy or accomplishment represents the self-evaluation dimension of burnout. It refers to feelings of incompetence and a lack of achievement and productivity at work. So, again, this is a term that many people use in the general public, but there's also the research side of things that has actually looked at what the triggers and what the effects are of experiencing this construct called burnout. An additional source of stress, we have frustration. This is, of course, a negative emotional state that usually is a result of being blocked from attaining a goal. So, for instance, you might think about how you might feel if you didn't get a job that you wanted. And of course, the more motivated we are, the more frustrated we are when our goals are blocked. So, how do we handle these stressors? Well, one response that has been relatively well studied is called the general adaptation syndrome. This is the biological response that we have to stress, and it's characterized by 3 phases. The first phase is called the alarm phase. You can see that this phase is the initial phase that begins after we experience the stressor. When surprised or threatened, for instance, your body enters this phase and you experience some resistance to stress that's temporarily suppressed. And what happens is your arousal is high. We see this sort of classic fight or flight response attempt to kick in, which we talked about in the previous topic. But generally, this is an energy expenditure type of response. During the next phase, that a researcher called Hans Selye described. He called this the resistance phase. So if the stress continues, your body rebounds to a phase of increased resistance. Physiological arousal remains higher than normal. There's an outpouring of stress hormones. Again, these are usually adaptive in the sense that they help us cope with things in the short term. These things really only become problematic when they become longer-term stressors. And in the third phase, the exhaustion phase, which again is a result of the increased length of time that we're exposed to stressors, your body's resistance to stress starts to break down, and exhaustion starts to set in. So during this final phase, you become more susceptible to illnesses and other types of damage to the body. In fact, Selye maintained that one outcome of this exhaustion for some people was the development of diseases of adaptation, including things like asthma, ulcers, which we'll talk about in a few minutes, because that's a bit of a misconception related to the fact that stress causes ulcers. They may have a role in exacerbating them, but it doesn't appear that they outright are the cause of ulcers. But this stress response does also appear to be related to things like high blood pressure. So during this biological response, we have two basic pathways that our nervous system activates to help us deal with these stressors. First of all, of course, when we experience a stressor, our brain processes this stressor first. Okay, so it's going to start out in our brain, and within our brain there are some structures that are intimately involved in this. The first one that we talked about in the previous lecture as well was the hypothalamus. Okay, this activates what's called the SAM system, which stands for sympathetic adreno medulla system, and also another system called the HPA axis system. HPA standing for hypothalamic pituitary adrenal axis, which are both seen in this diagram here. So the SAM system provides the initial rapid acting stress response, whereas the HPA axis responds more slowly, but also lasts longer. So again, in the SAM system, we have the sympathetic nervous system stimulating the adrenal medulla. This is, if you recall, a gland in our body that releases norepinephrine and epinephrine. This results in an increase in our heart rate, blood pressure, respiration, muscle tension, and a decrease in functions that are associated with what's occurring while we're at rest, things like digestion and constriction of blood vessels and whatnot. The HPA axis, as I mentioned, the pituitary gland causes activation of the adrenal cortex, which then releases corticosteroids, the most well-known of which is cortisol. This results in blood sugar and metabolism levels increasing and an increase in energy, which of course is again adaptive in the short run when we need to be able to exert energy in order to escape from a dangerous situation. This cortisol sends a feedback message to the pituitary gland to restore the body to its baseline state, which is termed homeostasis. So, as I mentioned, stress is related to the functioning of our physical health. Okay, the two are not independent, even though we might think of one as more of a psychological response. Our reaction to stressors is integrally related to the functioning of our physical body, our physical health as well. In fact, one of the new fields that is an interdisciplinary field that studies the effects of psychological factors on the immune system is called psychoneuroimmunology, which of course reflects the fact that there are psychological processes, neurological processes, and immunological factors that all interact with one another to impact the way that we deal with and respond to stress. So the biological response to stress, it can result in changes in the activity of the immune system, which can put it at increased risk of developing things like cancer. Again, not causing cancer, but contributing to the development of cancer, periodontal disease, the common cold, even arthritis, and Alzheimer's disease. In fact, there are very few diseases that have not been shown at one point or another to be impacted adversely by stress. Stress also can, in addition to impacting our physical functioning, it also has the potential to adversely impact our cognitive functioning. And again, research into this area has shown one of the pathways through which stress can impact our cognitive functioning. So we talked about a structure in our temporal lobes that's very important in terms of the storage of and encoding of memories, called the hippocampus. Well, there's actually when we are exposed to stressors and we release cortisol, again through the HPA axis system, we see that cortisol can actually cause, again in the long term, can cause damage to the hippocampus, which can actually result in an increase in the production of cortisol, because there are these feedback loops where the cortisol should be shut off normally, but when there's damage to these structures, we're disrupting the feedback loop, and the cortisol doesn't get turned off properly, and it can lead to further damage to brain structures. So again, we see that there's a lot of research going on in the area of post-traumatic stress disorder, looking at the adverse effects of stress on the hippocampus, and we'll talk about post-traumatic stress disorder a little bit later on. That's obviously one of the classic examples of the effect of stress on our psychological functioning. So again, although cancer is not caused by stress, stress does have an adverse impact on our immune system, and because of that adverse effect on the immune system, it can make us more susceptible to problems that are associated with cancer. So again, there's no indication that stress in and of itself causes cancer, nor is there any indication that a positive attitude can be the effective treatment for cancer in and of itself. Usually when we see myths like this, there's a grain of truth to some of it, in the sense that having a positive attitude is better in terms of the way that we respond to cancer treatments than as a negative attitude. But it's not the case that a positive attitude will treat cancer in and of itself. So again, stress can compromise the immune system, and with a compromised immune system, that makes us more susceptible to adverse health effects. Stress is also related, it's well known to be related to cardiovascular disorders. It does contribute to the development of heart disease. What happens is fat is released into the bloodstream as fuel in response to stress. Of course, when we don't use fat for fuel, as we would during a normal fight or flight response, it adheres to the walls of arteries. This forms blockages, and that's sort of what cardiovascular disease is. It's when there's the development of problems with the functioning of a heart, largely many times related to the ability of blood to flow through vessels to the heart, to and from the heart. So the blockage of arteries, of course, can reduce the blood flow to the heart. That's one of the major causes of heart disease. And on the other side, reducing stress, exercising, eating a low-fat diet, these can help prevent the buildup of fatty deposits in the arteries. There was some classic research that went on several years ago at this point that looked at personality characteristics and the development of cardiovascular disorders. And this research suggested that there might be two different personality types. Now, it's very difficult to just classify somebody into one of two personality types. That's a bit of an oversimplification of personality. Personality is a bit more complex than just having two types. However, there do appear to be there is some research to suggest that some people that are referred to as having a more of a type A personality, they do display certain behavioral characteristics that are associated with increased risk of cardiovascular disease. And these include things like intense ambition, being very competitive, exaggerated time urgency, and having a hostile outlook, as well as being cynical. Type B personality characteristics, on the other hand, include things like being calm, patient, and relaxed. And it turns out that it's not just being a type A or a type B, but really it's the cynical hostility, again, in the research literature, that's been shown to be the strongest predictor of heart disease. So in terms of trying to determine the degree to which you're a type A or a type B, again, this is not a perfect measure by any means, but these are some things to give you an idea of the degree to which you're more of a type A or more of a type B. So, how casual are you about appointments? How competitive are you? How rushed are you? Do you take things one at a time? Do things slowly? Express your feelings versus keep them in? Have many interests versus few interests? And this is the scale that I mistakenly referenced before, where you multiply your score by 3, and again, just very roughly to give you an estimate of your personality type. But again, be very careful in thinking that there are just two personality types. Somebody with 120 points or more, again after multiplying by 3, is much more of a type A personality. Somebody with a lower score, that is less than 90, is more of a type B personality. And of course, anywhere in between those two extreme values is a personality type that's somewhere in between. So again, trying to pigeonhole people into just one of two personality types is a bit of an oversimplification of how personality works, but it can sort of give you an idea of where you fall on this continuum. There's also been some research on a different type of personality characteristic that's called hardiness. This is the resilience or the resilient type of personality characteristic where somebody shows commitment to personal goals, control over life, and view change as a challenge rather than a threat. Sort of the 3 C's to hardiness: commitment to personal goals, having control over life, and viewing change as a challenge rather than a threat. Hardiness is actually a learned behavior. That is, it's one of the things that seems to discriminate people, that when they're exposed to stress, they develop sort of the classic distress symptoms and have an adverse reaction, versus those that deal very well with being under stress. That's sort of what characterizes being having this hardiness personality trait. In terms of trying to implement these 3 C's, next time that you find yourself being under a great deal of stress, think about how you're committed to whatever is contributing to those stressors. If you have a number of exams, think about how you're committed to your college education, and so this taking these exams is just a part of working toward your overall goal. Think about how you can have control over certain things. You can rearrange your schedule to some extent when you have a lot of tests. There are things that you can do. One of those, of course, is not waiting until the last minute to study, but just the idea of thinking that you have control over your life is a powerful factor in terms of this hardiness construct. And then again, welcoming the challenge, seeing this as a challenge to be overcome rather than sort of an obstacle that's just getting in your way of accomplishing your goals, and sort of welcoming that challenge. Those are things that you can think about that can help you to develop more of this hardiness personality characteristic. And the other thing that I should mention is that these are traits that are studied by a group of psychologists that refer to themselves as positive psychologists. Again, these are psychologists that look at the more positive aspects of human functioning, the things that allow us to function optimally, rather than just dealing with problems. What are the things that we can do to enhance the quality of our lives? And that's again one of the things that hardiness is seen as doing. It's seen as being something that if we work toward becoming more hardy, we can actually not just respond to stressors better, but also enhance just our daily functioning. And there's a website that you could go to. It's www.authentichappiness.org that is maintained by a psychologist named Martin Seligman, who is sort of one of the founders of this area of positive psychology. But in terms of some things that you can do to enhance your day-to-day living, there's some research support to suggest that if you write down 3 good things in life every day for 1 week, that can actually cause a longer-term improvement in your mood. Again, using this website here, if you look at what your signature character strengths are based on a brief questionnaire on this website, and then you try to use one of these top strengths in a new and different way every day for 1 week, that can also enhance your psychological functioning. And being mindful. This is an area that's received a great amount of support over the last 20 years. Being mindful just refers to being aware of the present moment. Just not thinking about the future, not thinking about the past, but being actively engaged in what's going on around you right now. Mindful awareness, again, this is an area that has a great deal of scientific support as a means to treat a whole host of physical and psychological ailments, but it can also reduce stress, improve attention, boost the immune system, reduce emotional reactivity, and just promote a general sense of health and well-being altogether. So I mentioned PTSD earlier, post-traumatic stress disorder. This is it was historically classified as an anxiety disorder, although there's been a change in the classification of PTSD so that it's now considered to be a stress disorder rather than an anxiety disorder. That's something that we'll talk about when we talk more about the psychological disorders themselves. But it is a disorder that's characterized by symptoms that are very much related to anxiety. Okay. Usually this develops in response to exposure to a life-threatening or extreme event that evoked great horror or helplessness. The symptoms are characterized by having flashbacks, nightmares, not being able to stop thinking about the event that was experienced. Although 70% of adults have experienced a severe traumatic event, only about 20% of those individuals will actually develop the symptoms of PTSD. So even though we may think that if you're exposed to a traumatic event, there's a chance that you'll develop PTSD, there's actually a greater chance that you will not develop PTSD than the likelihood that you will. And that's because of the fact that humans are quite resilient. We can deal with significant stressors and come out of them being okay. So although we tend to hear about PTSD so much in the media, that has a tendency to make us neglect the degree to which we are resilient from developing these symptoms as well. So in terms of what the primary symptoms of PTSD are, as I mentioned, they involve re-experiencing the event through vivid memories or flashbacks, feeling emotionally numb, feeling overwhelmed by what would be considered more or less a normal everyday situation, having diminished interest in performing normal tasks, having difficulty controlling your crying, isolating oneself from family and friends, relying increasingly on alcohol or drugs to get through the day, sort of self-treatment, feeling extremely moody, irritable, angry, suspicious or frightened, and feeling a sense of fear and doom about the future. But again, there are important tips that can help you to cope with crises such as these. If you've experienced a traumatic event, again, recognize your feelings about the situation. It's okay to talk to others about your fears. Know that these feelings are a normal response to an abnormal situation. And again, just because you're exposed to something that is very traumatic doesn't mean that you're automatically going to develop these symptoms. They could be more transient. They might last, a few weeks, but gradually over time, most people do show an improvement in their symptoms. If you know someone who's been traumatized, be willing to patiently listen to them and to their account of the event. Pay particular attention to their feelings, and encourage them to to seek counseling if necessary. Be patient with people. Recognize normal crisis situations and the impact that they can have on sleep and nightmares, things like that. Take time and do things that you enjoy. Those are all important tips for ways to deal with crises. So I mentioned health psychology as a relatively new field, or subfield of psychology, that is. It's the field that studies how biological, psychological, and social factors interact with health and fitness. So health psychologists do things like help prepare people for surgery or other treatments, sometimes even evaluate them to determine whether they're good candidates for surgeries or treatments, educate the public about the effects of stress, smoking, alcohol, lack of exercise, identify impediments to people who are having difficulty with decreasing habits such as smoking or alcohol use, or how to increase people's engagement in exercise. They also help people cope with chronic illnesses, and they help, as I said, people change unhealthy behaviors such as alcohol use, smoking, and even things like anger expression. And most health psychologists, they work from a biopsychosocial model. Okay, they look at the biological factors, the psychological factors, as well as the social factors that impact health. So, in terms of coping with stress, there are some psychologists that suggest that there are two separate steps in coping with stress. The first, there are two types of appraisal. The first type of appraisal is called primary appraisal, and that's when we just determine whether a situation is harmful, threatening, or challenging. Right? That's the first step, because if it's not harmful, then we're not going to have much difficulty coping with it. If it is harmful, threatening, then we need to make another decision. That's what brings us to secondary appraisal. Here, we assess our resources and choose a coping method if we have one available. So, in the secondary appraisal stage, even if in the primary appraisal stage we determine that something is harmful, threatening, or challenging, if we believe that we have the resources to cope with it, it's not a bad thing. It's really only when we don't believe that we have those resources to deal with the problem that we have difficulty with coping. And in terms of how do we cope, when we choose a coping method, there are two relatively distinct types of coping methods. There's emotion-focused coping, which helps us to manage our emotional reaction to the stressor, and there's problem-focused coping. This is the type of coping where we deal directly with the stressor to try to decrease or eliminate it. And both of them have their place in terms of coping. Emotion-focused coping can be beneficial, particularly in the short term when we're just trying to deal with the stressor immediately. Okay, this can sort of buy us some time to work on a more problem-focused coping approach, where we actually take those steps to decrease or eliminate the stressor itself. So I just mentioned that part of what determines our ability to cope with stressors has to do with the resources that we have. And there are different resources that we have or can make available to ourselves to help us cope with stress. The first and possibly the easiest one that everybody could implement is exercise. Okay, exercise has been shown, again, in research studies, to have an enormous number of benefits. Dealing with stress is just one of them. It's an effective treatment for just about every psychological and physical disorder. Having positive beliefs has also been shown to be an effective way to deal with stress. That's not to say that you are unrealistically positive, but having a positive attitude as opposed to a negative attitude can be helpful in terms of dealing with stress. Having good social skills is important because of the role of social support. Okay, social skills allow us to effectively engage with other people. Social support is the support that we receive from other people, friends and family members, and whatnot. That's an important source of coping for most people. Having a sense of control. We talked about this before in terms of hardiness. Believing that you have control over stressors has been shown to be much more beneficial than feeling as if you have no control over the stressors. Also, material resources. Although money can't buy happiness, having money does provide you with access to options that can be effective at reducing the effects of stress. Two additional things are having a sense of humor. Research shows that having a sense of humor is one of the best ways to reduce stress. And also relaxation, that we can actually engage in relaxation training in order to improve our ability to manage stress. And one well-researched way of engaging in relaxation is called progressive muscle relaxation. It involves the systematic tensing and releasing of muscles. And as you go through all the different muscles of your body by systematically tensing and relaxing them, and that's what progressive muscle relaxation is. It's been shown to help people to enter into a very relaxed state, which can be particularly beneficial when an individual is in a state of anxiety or when they're attempting to cope with stressors.